Hello, my name is Representative Pam Powers Hanley, and I represent LD9 in Tucson in the Arizona House. Well, today is May 20, 2020. It's my husband's birthday. Happy birthday, honey. Unfortunately, I'm not in Tucson with him tonight because I'm up here in Phoenix. So today was another nutty day in the Arizona House, and in fact, it was even nuttier than yesterday. Yesterday, we passed several insurance industry bills that pretty much had nothing to do with the coronavirus or any other sort of emergency, and the Democrats said, why are we doing this? We should sine die, end the session, focus on COVID-19 in special session, or perhaps pass a limited number of bills that actually forward the cause of fighting the coronavirus. And so today it was just a mixed bag. And the one thing that really blew up was when Representative Weninger proposed SB 1397. Now, on the surface, this doesn't seem like a horrible bill, but it doesn't go far enough. And so this is one of these Republican bills that says, well, if the Affordable Care Act is repealed successfully, then we want to have pre-existing conditions covered, because that's one of the most popular things that the Affordable Care Act does. It has got rid of the insurance company scam regarding pre-existing conditions. 1397 requires insurance companies to cover pre-existing conditions in the future if the ACA goes down. My concern with this bill is that it doesn't cover all the other things that the ACA does. Like, for example, letting your adult children stay on your plan, or the essential benefits, or maternal and child health care, and things like that. So it is one of those election year bills that sounds good, but doesn't go far enough. 1397 doesn't go far enough. Really, we should be protecting and expanding the Affordable Care Act rather than whittling away at it and then coming up with a bill like this that only goes part way. This bill would primarily help people who can afford to buy an insurance plan that would cover pre-existing conditions. That's not everybody. The plans in the ACA and on the private market are already very, very expensive, and many people say that they can't afford insurance, and therefore they are either uninsured or underinsured, even with the ACA. So my suggestion is that we need to shore up the ACA, replace it with Medicare for all, or fix the insurance system in this country. It's out of whack. Everything is way too expensive. Insurance is too expensive. Medical care is too expensive. The drugs are hard for people to get. The people are told that they're not allowed to have the drugs that make them feel the best. And so the whole healthcare system in the United States is out of whack. 1397 protects the rich people who can buy an expensive plan in the future, but it doesn't help the rest of us. If we want to shore up the state's healthcare system, just in case the ACA is taken down at some point, we need to add Representative Butler's amendment onto 1397. And unfortunately, the Republicans shut her down today, and we were not even able to debate what was left out of 1397. That's not justice. That's not appropriate. The Democrats represent 48% of the constituents in the state of Arizona, and our voices need to be heard, because when our voices are not heard, your voices are not heard, and that's not fair.